Going to start with an advanced organizer, and these will be the topics we'll cover today. So a bit of an introduction around ethics. We'll look at our ASHA Code of Ethics. We'll spend some time on ethical decision-making models, because I think you know our ASHA Code of Ethics doesn't tell you exactly what to do in any given situation, but we move through some decision-making models to interpret the Code of Ethics. Then we'll bring in some cultural aspects and we'll contextualize these ethical discussions. That means we might think about historical factors, political factors, institutional issues, and the larger societal context. Hopefully, we'll engage in some self-reflection, some self-reflective practices, and that means we'll be thinking about our emotional reserves and our state of mind. And that's going to bring us to concepts related to compassion fatigue and burnout. We'll finish with some considerations and strategies and a summary conclusion. This is what I really like about ethics. What I like about ethics is it can give us the pause, and the pause can help us start to observe. So I feel that when we think about ethical dilemmas, maybe we think about them before they've even happened. Maybe we start to look at the risk factors that could potentially put us into situations where we would have an ethical dilemma. So are there systems level issues? Are there policies, practices, procedures, collegial relationships that could lead us toward a situation where we might end up in an ethical dilemma? So are you observing what's happening around you, the work culture? Are you looking at your documentation systems? Are you thinking about how you talk about your work? Are you reflecting on how you engage in social media? Are you thinking about how you represent what you do to your patients, clients, colleagues, related professionals? So bringing in regular observation, pausing before we immediately act, and then doing a bit of studying around why is ethics important? How are our cultural values shaping our problem solving, our ethical problem solving? And then this is where we're heading next. Pause and reflect on how you are doing, because I think you may know already, decision-making is complex. Ethical decision-making is complex. It takes cognitive and emotional reserves. We need to be aware of our own state of being, our own health and wellness, because we're not going to be able to make these good, solid, important ethical decisions if we're burned out, overly fatigued, and we don't have the cognitive and emotional reserves. So we're heading into some self-reflective practices. So we think about the cultural aspects, we think about the context in which everything's happening, and we start to focus on our own state of mind.